Hello, everyone, and welcome to this very special town hall meeting with Congresswoman Mikie Sherrill. My name is Robert Allen, and I'm part of the board at the Livingston Chamber of Commerce. I want to welcome everyone and let you all know that this is made possible by the Livingston Chamber of Commerce, along with the West Orange Chamber of Commerce and the North Essex Chamber of Commerce. And now more than ever, you need to be supporting your local Chamber of Commerce. I know many of you on here today are already members of the local chamber. Um, I am a member of two of the chambers that are represented today. Without your local Chamber of Commerce, we can't do business together. So I encourage you, if you haven't joined, do so. If you're already a member, join another chamber. We need to support local business. Just as by way of housekeeping, we have a Q&A interface available to you on your screen. That is how you can ask questions. I can tell you we have a very limited amount of time today. We will try to get to as many questions as possible. We will make sure that all of your questions are forwarded over so that we can get those questions to Congresswoman Sherrill. I'm going to turn it over now to the president of the Livingston Chamber of Commerce, Monty Ehrenkrantz. Monty, you're now unmuted, and you're on.
Thank you, Robert, especially for organizing and implementing the technical part of this afternoon's Zoom meeting, where Zoom is a word everybody knows these days. I've been to many Zoom meetings before, and I know with your help, this is going to be another great meeting that we have. As Robert mentioned, my name is Monty Ehrenkrantz. I'm the president of the Livingston Area Chamber of Commerce. I want to welcome everyone from our chamber, as well as the chambers of West Orange and the North Essex Chamber of Commerce, which consists of Caldwell, Cedar Grove, Essex Fells, Montclair, North Caldwell, Roseland, Verona, and West Caldwell. I know that one of our goals of our chambers is to promote business amongst each other. Unfortunately, during this COVID-19 crisis, doing business amongst each other has become difficult, to say the least. So as one of the chamber leaders, I thought that it would be a good idea to get some experts in front of us and let us know what's going on so we can get back to work and do what we do best, networking and doing business amongst each other. We have three amazing panelists today that are going to inform us as to what assistance is available to us as small businesses and as individuals. Our first guest is going to be introduced by the Mayor of Livingston, Rudy Fernandez.
Thanks, Monty, and thanks for doing this. First, Congresswoman, I was happy to hear that your husband is feeling better and you and the family are doing well. That's great. You know, and I remember back in January of this year when we hosted the very first town hall meeting of 2020 right here in Livingston, and times certainly have changed since then. On behalf of Livingston and the entire Livingston Town Council, Sean, Ed, Al, and Michael, and myself, we thank you for your leadership during this pandemic. We appreciate your constant communications, and we appreciate all that your staff has done, your entire team, Jill, Kelly, Jackie, and everybody else. For those that do not know, Congresswoman Sherrill is a graduate of the Naval Academy, a veteran, a former federal prosecutor, and was elected to represent the 11th District in November of 2018. Since going to Washington, she's been a terrific advocate for veterans, for seniors, for taxpayers, still pushing for the SALT deduction. We thank you for that. And most recently working with her colleagues on various COVID-related issues, whether it's fully funding the current tests, the federal test sites, and also getting more lenders to participate in the Paycheck Protection Program. So, you know, not only was the Congresswoman representing the residents of the 11th District prior to this COVID pandemic, but has been working with her and her team and her colleagues extraordinarily hard, you know, during this process. So with that, I would like to introduce Congresswoman Sherrill.
Well, thank you guys so much for having me. Thanks, Rudy, for that great introduction. Livingston's been such a wonderful town, and you guys have really worked hard to support everyone through this tough crisis. I think Pat might even be on, and I think we have possibly our county executive could be on as well today. But I'd like to thank Monty Aaronkrantz of the Livingston Chamber of Commerce for bringing us all together today. I'd like to thank the Livingston, West Orange, and North Essex Chambers who are participating today. You read the list. It sounds like basically all the towns in the 11th district in Essex County, so it's great. I'd also like to thank Dr. Handler and Paul Seppi for joining me on the panel. Many of you have heard the news that my husband Jason tested positive for coronavirus. I want to share with you that I went for a test at the Essex County site in Weequahic after experiencing some mild symptoms, and the test came back negative. First of all, I would just like to praise Essex County for running such a great testing site. And thank you so much to everyone in the community for your prayers and for all the nice messages that you sent. We've unfortunately lost hundreds of residents to COVID-19, beloved mothers, fathers, grandparents, siblings, and neighbors. Our doctors, nurses, first responders, grocery store workers, utility workers, postal workers, restaurant chefs, and delivery couriers, and so many more are really putting their health and their safety on the line for us right now. And I have to tell you, I'm on a conference call every morning with our healthcare providers, and it's tough. It's really tough for them day in and day out to see all the people struggling to beat this horrible disease and to be so fearful for their own health and the health of their families. But together we found ways to connect online with our friends and neighbors, much like we're doing right now in this town hall. So we're here this afternoon to talk about the impact of the terrible virus on small businesses and workers in particular. I speak every day to small business owners and local elected officials, and I hear just how hard it is for all New Jerseyans and how much everyone is suffering. I wanted to take a few minutes today to give you an overview of what I've been working on, the federal legislation that Congress passed to help small business and workers. And to let you know, I traveled to DC last month to vote on the third piece of coronavirus response legislation, the CARES Act. And that was signed by the president on March 27th. This was a $2 trillion package of legislation, and some of the money we've seen in some of the HUD grants has already started to come into our district. Morris, Essex, and Passaic counties, as well as Parsippany, Wayne, and Bloomfield, were awarded funding for the Community Development Block Grants, the CDBG grants, housing assistance, and for homelessness prevention. This grant funding is being administered by the Department of Housing and Urban Development using the standards formula that's been used for this funding in fiscal year 2020. The funding represents just a small share of what's ultimately going to be coming to New Jersey. Importantly, the legislation included a coronavirus relief fund to help states and municipalities address the COVID-19 crisis. New Jersey will be getting $3.44 billion from a block grant. We're also greatly expanding unemployment insurance. So not only are people who've traditionally been covered by unemployment insurance going to be covered, but also people like part-time, self-employed, and gig economy workers, they're going to have access to benefits. We also passed a $600 increase per week for every American in the bill. So you'll get $600 more for unemployment insurance for every week you're on it, which equates to 100% of wages for the average American without a paycheck. Also expanded was the Loan Forgiveness Program and Paycheck Protection Program, or the PPP, many of you are familiar with. I know our team has gotten calls from many constituents about these programs, and those were put out last Friday. We had already been on the Treasury Department to get the regulations out in a more timely manner, and we've been dealing with them now, trying to get them to take immediate steps to encourage additional lenders to issue the Paycheck Protection Program loans to small businesses struggling due to the COVID-19 pandemic. Congress has given full authority and funding to the administration, so we really need Treasury to make sure that our small businesses in New Jersey have access to these loans. The legislation includes direct cash payments to lower and middle income New Jerseyans, $1,200 for each adult, and $500 for each child if you're making $75,000 or less as an individual, or $150,000 or less for a household. We have more work to do to help our state. I'm already getting to work on the fourth piece of coronavirus legislation. There's strong bipartisan support to add more money to the SBA loan program. And part of the reason we've got to get to work is because many of these programs have been so necessary to people right now. I also want to look at some of the timeframes we set in the third package. So as we face this crisis, we're providing enough relief to our communities and provisions aren't expiring before we get to the other side of the crisis. And I want to pass on some information that I heard on my daily call with our medical providers yesterday morning. They're really emphasizing the continued importance of social distancing. So we have actually seen the curve starting to flatten in the 11th District of New Jersey, meaning we're still having more cases coming into the hospitals, but not at the rapid rate we were seeing just a couple days ago. As you know, our social distancing started weeks ago, and now we're seeing the impact, so it takes a little bit of time. And I'm just bringing that up because I know this is a tough time to be away from family. Passover starts tonight, Easter weekend's this Sunday. I realize my kids are already bugging me, why aren't we going down to our cousin's house? But we are seeing the social distancing start to work, start to make inroads, and it's so critical that we get the healthcare portion right so we can get the economic portion right. I know how tough and uncertain these times are, and I know the Chamber has been a great partner with resources, and I know you're doing a lot of programming like today to help your members through this. So I would love to continue to work with you. Please consider my office a resource for the programs. We have stuff up on our website. We just had a town hall last night with the small business administrator and some state programming administrators. So I would love to continue to support the community in that way, and would love to take some questions.
Thank you, Congresswoman. You can hear me, I hope, right?
Yep.
Okay, good. Thank you, Mikie. First off, I want to thank you so much for attending today, agreeing to attend. And I also want to thank Jill and Jen from your staff for helping me. They were really good, and I appreciate all their help. We do have a few questions. If you do have some time, I know you're out at 2:30, so we have a few questions. One of the questions that came in is, with all the news that's been going on and all the talk and inconsistencies, what are you hearing in Washington as far as when people are going to possibly be back at work?
Well, like many of you, that is a huge concern of mine, is how quickly can we get people back to work in a safe way. So I don't think we have a date certain yet. Some of that is dependent on the virus. I will tell you the social distancing is already helping. I think we're seeing across the country some of the worst case scenarios are not playing out. We're not in the worst case scenarios, which is great. The better we do the better we address the public health crisis in the near term, the better our economy will do in the long term. We are anticipating in New York, the height of the crisis, the height of their curve is going to occur in about a week. Here in North Jersey, we're probably about 2 weeks for the height of the curve, maybe a week and a half. And then we'll be able to, once we start to see the cases coming down, and we'll be better able to determine how to get people back to work. But we really have to, I think, be focusing right now on what that's going to look like. As I mentioned, and you might be experiencing this if you're a small business owner and talking to your employees about maybe they've been working from home or when they might come back in, people are scared. I think we've done a really good job explaining to people why social distancing is important. So we've got to get them comfortable then on the other side of this with going back to work. I think that's going to involve masks so people are comfortable. We have many employers here who have overseas companies. They're seeing testing at the facilities. They're continuing to see social distancing at the facilities, even some areas where you pick off shoes or have booties that you put on to stop the spread, as well as questionnaires at the door that you fill out to make sure you haven't come in contact with someone with coronavirus. We also, and this is something that we've been advocating for in the House for really weeks and weeks now, testing. We need to have wide-scale access to testing. And I've been back and forth with FEMA on this. I know the whole delegation, as they were saying they were going to pull out their FEMA testing sites April 10th. We said that was unacceptable. Now we've gotten, and them to say they'll stay till the end of May, but really we're still having problems here with testing. We're doing better, but the more widely tested people are, then the more the tests start backing up. So we still just don't have that. You go in, you drive up, you get tested, by the next day you have your result. I mean, ideally it'd be the next hour, but and we're working towards that. But we need this so that when people start to go back to work, if someone shows up with an illness, you can rapidly find out if it is coronavirus and then who they've been in contact with, quarantine those people so we don't have another outbreak in our community. That's really important. We're also looking at what they call serological testing. So to determine if, many of you heard my husband had, tested positive. He's been sick for a couple weeks. So I went in and got tested and I was negative. And I'm not sure what that means. I can't imagine that I've not been exposed to coronavirus after living with my husband for a couple weeks. So does it mean that I had it and I just didn't realize it and now I'm immune to it? What exactly does it mean? And there are so many people that maybe have been exposed and could get back to work comfortably if they knew they had the antibodies. So we need serological testing. And we all just, I think, need to talk to the community about what this looks like, because again, we need people to be comfortable that as we start to see these signs, as we start to see the test case numbers fall, as we start to get the PPE and the testing back, then we can start to get people back to work, and they need to be comfortable doing that.
Thank you. That's a great answer. I know you mentioned a little bit about this in your talk, but somebody's asking a question. I know that the CARES Act covered a lot of areas, and being a banker, I'm seeing so many applications come into our bank, which we're still having difficulty getting processed, but I understand that the SBA has been working on that. But there are the CARES Act covers a lot of areas, and we're not sure that this is enough. I am really concerned about the future of our economy. What are you thinking about for what comes next?
So what we're asking people to do throughout the community is to alert us to any gaps or holes that they see that is going to be harmful to our economy down the road. So we put out in the CARES Act, which was actually our third piece of coronavirus legislation, a $2 trillion piece of legislation, support for small businesses. That includes payroll protection, so that you can have fully forgivable loans. Originally the legislation had simply loans, and I said, a lot of my small businesses aren't going to take loans because they don't know what they're going to look like on the other side. These have to be grants or forgivable loans. So they're forgivable loans. As long as you keep people on your payroll, they'll be forgiven. If you have to let some people go, it'll be prorated. We have money for your mortgage interest, for your rent, for your utilities, different things to help you get through this time period. And then if you can't, we've expanded unemployment. So that was kind of our first major piece to take care of some of these businesses. If you're finding there are gaps, if you have specific areas where, the question was, I don't think that's enough. What are those areas where you're really most concerned about? Where can we shore it up? I think we've, in a bipartisan way, come to the determination that we need to expand it, that we need to put more money into the program to ensure more people have it, so that if down the road your small business starts to suffer, that support is there for you, and you're not scared that it's going to dry up or the funds are going to be gone. So we know we need more money. But again, we're working on more legislation now. We're already working on the coronavirus piece of legislation 4. And that right now has been narrowed to really some small business, more support funding and expansion of the small business funding. I think we're looking at some healthcare funding as well in that.
Hold on, I'm on mute now. I'm not muted anymore. That's a lot of information that you spoke about. Is there one place people can go to find out all this information?
So we have put out, and we're updating it daily, our website, all the information we're getting. As I mentioned, this is a massive piece of legislation, and we were trying to move as Congress very quickly, which we're not always known to do, but we moved very quickly to get this money out to people who are in crisis. all of us realize we're in our districts every day. I'm talking to small businesses and healthcare workers and individuals every day. And so I know how hard hit we've been. So we wanted to get this money out as quickly as possible. We tried to utilize some of the existing frameworks like the Small Business Administration to get the money out in an effort to get it out more quickly. However, some of the regulations don't meet the new expanded help that we're giving to people. So I know Treasury has been slow. That's why I've been talking to them. The next person on my list right now is the Department of Labor, if they don't kind of speed up a little bit. So we're working hard to get the administration to get the regulations out so people have that information. We're updating our website constantly. I know the Small Business Administration is working hard. And I know the state has programs as well that they're working really hard. You can find a lot of this on my website, sherrill.house.gov. We have a coronavirus portion. We have a newsletter that you can sign up for. The newsletter, we push out the information as we receive it as well.
Thank you so much. I know you have a lot of things going on. Your schedule's hectic. I again want to thank you so much for coming on with us today. You've been very active in your district and our community. We've seen you around a lot. And I want to just say that, you know, we appreciate you coming here. I think you won the election because you came to my Rotary Club when you were running. Yeah, so I think we put you over the top.
You did
and,
it.
Yeah, and I'm wearing a tie today for the first time in 2 weeks because of you. So again, I just want to say thank you very much for your time, and we appreciate it. And good luck and best of health moving forward.
Well, thank you all so much. Please use my office as a resource. And as I said, we'll continue to work to support the district. Please let us know the things and the gaps and the areas where you need help. And I really appreciate it. Thank you.
Thank you so much.
Have a good one.
You too. Okay. I'm now going to go ask for one of our other chamber board members to come on board. I don't see her picture yet, but there she is. And she can unmute herself now. There you go. So Margie Heller is a board member on the Livingston Chamber of Commerce with me. And she's a vice president of Community Health and Global Partnerships for RWJ Barnabas Health. And she's here today to introduce our next panelist. Thank you, Margie.
Thank you, Monty. Thank you, everyone, for being with us today. So I'm going to introduce Dr. Eric Handler. He is he's board certified in emergency medicine. He is an attending emergency physician at St. Barnabas Medical Center and North Beth Israel Medical Center. And he is our medical director of operations at St. Barnabas Medical Center. On a personal note, I just wanted to say Dr. Handler is not only a great physician, but he is an incredible leader, mentor, and a friend. He's compassionate, caring, and a go-to practitioner who is always the first one to step up and assist. He's always been a hero, not just through this pandemic. He's just that guy. Yes, people and employees are rising up like never before, but Dr. Handler has always been at the top. With that, I'm going to turn it over to Dr. Eric Handler.
Hi, good afternoon. And so thank you for having me and inviting me to be part of this panel. And Margie, thank you for the extremely kind words. It's always a pleasure to work with you. And you have done so much for the community, not only through RWJ, but through the Chamber of Commerce and just with other community members as well. I'd also like to give a special thanks to Robert Allen and the entire crew for Livingston Helping Neighbors. My entire family watched the Livingston Sings event the other night, and I know the event raised significant money to help those in need. So thank you. It was a phenomenal event. The talent was great, and it was fun to watch you, your friends and colleagues host as well. So as Margie mentioned, I'm an emergency physician at St. Barnabas in the emergency department, and these no doubt are trying times. We have not necessarily high volume, but extremely high acuity these days with the COVID-19 pandemic and the patients that we are seeing. We, over the past couple of days, have seen less patients in volume, but we still are seeing a good number of COVID-19 patients come through our doors. And unfortunately, it is still the older members of our communities that are having trouble with breathing, airway, and unfortunately sometimes ending up requiring artificial resuscitation and ventilation. And to that end, again, Margie, thank you for the kind words, but I am but a small cog in a very big machine that is taking care of these patients. The nurses, the ICU team, the other critical care members, the housekeeping staff, which puts themselves on the line every day, cleaning up the rooms and after patients that have had exposure and are sick themselves, and all of the radiology techs and physicians who, again, day in and day out, are treating these patients as if they did not have any disease, in regards to just making sure they keep themselves safe, but providing the excellent medical care that we have in the past and not allowing this to stop us from doing what we need to do for these patients. It is extremely heartwarming to see the support of the community. I mentioned the Livingston Neighbors Helping Neighbors, but just the community at large, and not just the Livingston community. I know there's multiple chambers on this call. There are Milburn, Livingston, Short Hills, Newark, East Orange. The list goes on in regards to those that have donated not just equipment, but food to the staff. I believe we're up to feeding over 600 people a day just at Barnabas, and I know there's other facilities around that are receiving these contributions as well. Two huge thank yous to, and again, the list could go on, but two in particular that have been amazing in regards to securing PPE and that's personal protective equipment at no cost to the facility. They do it by raising funds in the community and then buying this equipment. The Asian Society of Milburn and the Asian Society of Bridgewater, through working with Dr. Sue Wang and Peter Lee. Dr. Sue Wang heads up the Asian healthcare for RWJ, and Dr. Peter Lee is actually one of my colleagues in the emergency department. He's on staff both at Barnabas and at Jersey City Medical Center, where he's the associate director. And through them, we have been able to procure PPE that early on, I don't believe we otherwise would have, and it really has helped tide us over until the system itself can get these supplies. As you know, in the news, the ads, Mikie mentioned it as well as other community leaders, the best thing that people can do right now, as tough as it is to stay home. That doesn't mean be scared and lock yourself in your room. It means be safe, be smart. You can still be outdoors and have fun and social distance. We don't want people to come into the emergency department because they now have major depression because they're not getting any sunlight exposure and seeing the outdoors. But again, 6 feet apart. If you're with your family and nobody is ill, go for a nice walk, go out in the backyard. I understand that the parks are closed and that's for good reason, but there are definitely still ways to enjoy yourself, time with your family, and get outside. To that end, if God forbid you do find yourself not feeling well and you feel that you need medical care, if you feel it's an emergency, most definitely call 911. But if you happen to come down with a cough or a fever and you're not having respiratory difficulty or some other emergent event, I would strongly urge you, and we've also been speaking with our community leaders to talk to their constituents to do the same, to advise people really to stay home. Unfortunately, for this virus with mild symptoms, there is no acute treatment. So staying home is the safest thing you can do so you don't get others ill in your travel. Or if it wasn't from coronavirus, inadvertently pick that up in your travels and then make yourself otherwise ill. If you are having respiratory difficulty, by all means, please reach out to your healthcare provider. And if you feel it's in dire straits, and call 911. There are multiple providers in the community that are doing fantastic jobs with telemedicine. That would lead me to another tangent of thanking the medical community, not involved in day-to-day hospital work, but who have lent themselves and their expertise to pitching in when we need it. Pulmonologists who normally wouldn't be in the ICU, who are helping out with vent management, and the primary care docs doing telemedicine to treat their patients. So kudos to everybody really stepping up in this time of need. One of the other things that I wanted to put out there, because we are still seeing patients that come to the facility, not just at Barnabas, but other emergency departments, thinking or wanting to have the coronavirus swab done. We still are not a testing center for routine testing. There are multiple testing centers within the community that can be shared through the chamber and the other community leaders, either during or after this fall of the testing sites. Again, they are also available online. We have set up testing for our healthcare employees, but again, that is not community-wide. We are over time ramping up, but unfortunately still not at the volume where we can offer testing to the community at large. And so again, if you feel that it's emergent, please come in. Otherwise, please do your best to stay home and manage the symptoms with supportive treatments, things to help with the fever, medicines to help with the cough, etc. And if you do have a question, reach out to your physician and discuss it with them on the phone first, unless you think it's that emergent. And so that with that, if there's any questions I can answer at some point, please let me know. But otherwise, I will turn it back over to Monty.
Thank you, Dr. Handler. And do you have time for a few questions?
Yes, sir.
Okay, good. First of all, thank you so much. I know your time is valuable, and we appreciate you being here. I want to thank Margie again for probably twisting your arm to be here. We appreciate it, though. There's a lot of talk nowadays. These are some questions that were posed that I'm going to just quickly, ask you.
Sure.
There's a lot of talk these days about masks and making your own mask because masks are not available to the public. What is your opinion of wearing masks? What does it do when you wear a mask? And what is the best material if you're making your own mask at home?
Gotcha. So I'll try and hit those in order. And first, Margie never has to twist my arm. The only thing you took me away from was my eyes burning making some horseradish for Passover. So in regards to the masks, yes, we still are asking the general public to not purchase N95 masks, which are the respirator masks. They still are in short supply in regards to having them for the medical providers. Surgical masks, I think we're starting to do a little bit better, but we're still trying to keep those for the healthcare workers. So there really is no necessarily one best material. I have seen multiple things online, both via email and just my own personal research in regards to pretty much a good old-fashioned cotton cotton material, and it can be fashioned to one of many, many templates that are available online. There are starting to be people selling these on Amazon. So again, I would just caution people not to get swindled into spending large amounts of money on one of these. In regards to whether to wear the mask or not, that has been controversial, even within the CDC itself. At this point, they are recommending that the general public wear, again, a cloth mask to not go through supplies that the medical staff needs, but a cloth mask if you're going to be out and about. I came home from work last night and woke up this morning to my kids wanting to tell me a funny story where they saw somebody driving by. They were doing one of the chalk drawings on the driveway, and this person had a full respirator with the cartridges on the side and gloves in their own vehicle. I would tell you that I do not believe is necessary. If you happen to have it because you used to do paint work and it gives you some degree of comfort, great. But again, these are masks that are really needed for professionals and are not needed to take a drive to the supermarket should you need to get some dry goods.
Unmute, there we go. Okay, another question that I have, and you mentioned this in your discussion, based on information that we hear on the news, what is happening as far as lack of equipment and supplies, and what can the community do to help with that situation?
Sure. So the situation is much better now than it was just a couple of weeks ago. And again, thank you to those that have made those donations, and thank you to all the hard work for, I can speak to my healthcare system, but I know the other two major systems in the state are doing the same, and really thinking outside the box in regards to where to get supplies from. So we do now have, I would say, probably a few weeks out of supplies for masks, gowns, goggles, etc. So it is not where you were seeing on the news in particular. Unfortunately, New York City, people that were sharing picture photos of nurses in literally Glad clear garbage bags. We have fortunately moved beyond that point. But if people do want to help, I would tell you these two societies that I mentioned before have been phenomenal in regards to sourcing. And, at some point, if I can get through Margie, this information for these organizations where people could donate money, they collect money, they hit a certain amount, and then they go out to the suppliers, which mostly are out of China, because this is where this did start, and they have the supplies, and procuring them back to the U.S.
Excellent. I know Robert received a few more questions through the system. I'm going to turn it over to
Sure.
Robert for one or two more questions, and then you can get back to making your horseradish for tonight.
Okay, yes, thank you, Doctor. And if anyone does have additional questions, please put it into the Q&A box, and any of the questions that we don't get to, we'll make sure that we forward over to the doctor and have him answer those, and we'll share that with you. But one of the questions that did come in, Doctor, was from someone who's 71 years old, suffers with asthma, and wondering when they can kind of get back to work or being close to other people. Is there even a way to be able to judge that?
Wow. If I could prognosticate that, I would hop on my phone to the Jackbox app and buy myself a ticket. But all joking aside, unfortunately, that one, I do not have a sense of when we will get back to quote unquote normal. Right now, again, we are all social distancing, which I prefer the term physical distancing, because there are many ways to be social without being in physical contact with somebody. And again, the camaraderie and community is very important to help stave off some of the mental illness aspects which can come along with strict social distancing. So in regards to getting back to work, if you can't do it via some telecommunication device for the foreseeable future, and if you had to pin me down and give you just a guess, I would tell you this: we're looking at still probably a couple more months. Again, I leave that to people beyond my pay grade of giving us the actual when this is going to end in regards to the quarantine that's in effect for this area, New York and New Jersey. But again, we really still need to see some significant decrease in the disease process before we're telling people to, see their loved ones and get back to work if it doesn't involve telework.
And, I just have this question myself. I wonder, what will normal look like after this is done? How much of our, what we knew before, will change as we go forward through this virus?
So again, this is definitely a different virus than 2009. So I am in no way comparing this to H1N1 of 2009 from a severity standpoint. But you did see a lot of similar behaviors, not maybe necessarily to the degree of the masks in the community, but definitely, people wanting to distance themselves somewhat. And, God willing, we either come up with a way that is scientifically proven to treat, or a vaccine that is significantly effective. I still think this is going to be a seasonal illness, so hopefully moving forward. And there will need to be, when we see cases ramp up, some degree, not to the extent we're seeing now, but some degree of social distancing. I think you may see cloth masks, as you do in the Eastern countries, become a little bit more accepted and the norm. Still in the States, I would say outside New York and New Jersey, I would imagine you're not seeing a whole lot of people wearing the masks day in and day out. And that's just never been our culture. It has in the eastern part of the world, and I do see that probably becoming a little bit more accepted as things move forward.
Okay. Well, that's all the questions I have here. Doctor, thank you so much for all you, and thank you for the kind words about the concert. Glad you enjoyed it.
It was a lot of fun. I have one other point, because with the next wave that we're seeing now, and I forgot to touch on this, is patients who have been tested and have gotten the call that they're positive. We're starting to see a wave of people, once they find out that they're COVID positive, if they start getting a fever, some other symptoms, coming to the emergency department. Some actually just because they were told their test was positive. That's not necessary either, and can put a strain on the system. So if you know you're positive, and again, you're still otherwise doing well, please do the self-isolation, the self-quarantine at home, and try to refrain from the ED if at all possible.
Thank you so much again, Dr. Handler. We really appreciate your time. Stay safe.
Oh, anytime. Thank you.
Thank you.
Be well.
Okay. Most people are aware of the federal programs that are available for assistance, but not everyone knows that the state of New Jersey also has programs available for assistance for small business owners. Today, we're lucky to have a representative of the New Jersey Economic Development Authority, Managing Director of Business Development, Mr. Paul Seppi. Thank you, Paul.
Good afternoon, Monty. Thank you so much for hosting and inviting me to speak on behalf of the EDA programs. I'm very appreciative. First off, for the EDA, in regards to what we are, we're a self-supported independent authority out of state government. So certainly we take direction and guidance from the governor's office and team. However, we are off of the state's books, so to speak. So we operate a number of programs on behalf of the state. We have several programs that we have in our own coffers. We've been in existence since the 70s, and we provide companies for years. We've provided resources, loans for people to grow their business, employ people. So that's a very brief overview of what the EDA has or has done historically. Rob, if we can flip page, thank you. Last week or 2 weeks ago now, I guess, the authorities board, oh, I'm sorry. I already thought the screen was up. If we can hit one more ahead. The authorities board 2 weeks ago had authorized the staff to roll out a handful of programs which would hopefully help to stabilize or at least give a little bit of comfort to the New Jersey business community. Certainly these resources are not enough assistance to stabilize, but what is nice is that the programs have now built an infrastructure so that when additional dollars come into play, whether it is through a state appropriation and or the federal government, we'll have the resources in place to be able to get dollars out into the folks' hands that need it. Initially, there is EDA resources, but we're also partnering with our private institutions that we've done for years, and I'll cover that as we go through. Next slide, Rob. A quick snapshot and summary of the programs that have been identified. The Small Business Emergency Assistance Grant Program, which was released this past Friday, had over 27,000 applicants over the first several days. Needless to say, that allocation has been oversubscribed, and staff is working through that now. There's a loan program which I'll focus on, which that application is going live this coming Monday. And then it gets into a couple of programs that are there to help support and leverage resources, not just from the EDA, but in the private sector as well. If we can flip to the next one, Rob. Real quick overview of the grant program, as I referenced. The program at this point is oversubscribed. I will note that when I talk about other resources being funneled into programs, just yesterday, the Casino Reinvestment Development Authority had approved a $2 million allocation to fund Atlantic County projects or businesses as part of this program package. So we're hoping that if we can get additional dollars from other resources to help leverage those dollars, it's something that other folks have seen the importance and certainly the need for this. This is designed and targeted towards companies that have 10 full-time equivalent employees or less. And it was really focused at industries that are hardest hit. And certainly anybody that's had a negative impact feel that they are the hardest hit as part of their situation. However, in regards to retail establishments, restaurants, recreation, and typical retail trade are some of those that have really been devastated by this outbreak. And it was specific to NAICS codes that start with 44, 45, 71, 72, 811, and 812. A key component that goes with this program and the subsequent programs that I'll speak about is that there needs to be a physical location in New Jersey, a physical commercial location in New Jersey. The company needs to be registered to do business in New Jersey, has to be current on state obligations through the Department of Taxation and Treasury, as well as the Department of Labor. So that's something that goes consistent across the board. Robert, we can hit the next. The slides are a little off in my view, but the loan program is a $10 million allocation, awards up to $100,000 of funding for working capital needs. So rent or mortgage relief, property taxes, payroll, insurance costs, the essential carry costs of what a company would need since the outbreak's declaration would allow someone to be eligible. It's for companies that have revenues of $5 million or less, been in existence for 1 year, again, have current or they're on current with any obligations to the state through the Department of Treasury and Taxation and or the Department of Labor, showing an impact from the emergency itself, I think is self-explanatory, but it is something that needs to be identified. The loans are personally guaranteed by anyone, or would need to be personally guaranteed by anyone that's got a 10% or more ownership. And at least one of those guarantors would need to have a FICO score of at least 600. The loan is a 10-year loan for up to $100,000. The first year's worth of payments are deferred. The first 5 years has a 0% interest rate, and the subsequent 5 years, or the last 5 years, years 6 through 10, would be set at the authority's prevailing floor rate for its core programs. That rate today is currently set at 2%. Tough to see what it'll be in 5 or 6 years from now, but in no event will it be greater than 3. So something to keep in mind. We're also going to look at the global debt service, historical debt service and cash flow of the organization versus looking at what today's cash flow position is. As the impact grows, the cash flow of a company and their ability to service a debt declines. So we're going to look at historical data to help make that decision. And we're going to look at a 1.0 to 1 debt service coverage ratio. And if I didn't mention it, companies do need to be in existence for at least 1 year. This application goes live on Monday, the 13th at 9 a.m. You'll see at the end of the slide, you'll be able to access that application on the business portal that the state has set up. And that is cv.business.nj.gov. That website in itself has got so much information onto it, and it's helpful for a variety of different reasons. One, you've got FAQs and links to other programs and products that would be useful to you, not just at the EDA, but potentially through taxation, Department of Labor for unemployment questions, and other related state agencies. There's a chatbot feature there. So someone staffs that opportunity from 8 a.m. to 7 p.m. every day. This coming Saturday, they'll be on from 11 to 5. They will be off on Sunday for Easter holiday, but then back at it again come Monday morning at 8 a.m. And that'll run 8 to 7, Monday through Friday, weekends 11 to 5. So next Sunday they'll be back on, but this coming Sunday they will not. 1-800-Jersey-7 is another opportunity for folks to be able to talk through situations, but really that cv.business.nj.gov site is a great tool because you're able then to have interaction immediately with some folks that understand what you're going through, not directly, but indirectly, and have the ability to point you in the right direction for resources. There is an eligibility wizard on that site where you can enter in your key information about your company, your head count, your revenues, your number, I said that, your head count, your number of employees, your years in existence, and you would be able to identify programs, not just at the state level, but at the federal level as well, that you may be eligible for. That portal, as of not last night, but the night before, has a draft application of this loan program application that's proposed to be released on Monday, excuse me, the 13th. That will give you it's giving screenshots of each of the pages of the application itself, as it is web-based, but there's also a tutorial guide that will help you walk through and understand what you need to do. The application will be, or is designed to be interactive. So when we ask for a financial statement, you'll have the ability to upload your financial statement accordingly. If you're looking for lease relief or rental assistance, provide a copy of your lease. You'll upload that lease at that point in time, payroll, etc. So you get that idea. But again, that's a great resource for you. But the Small Business Emergency Loan Program, up to 10 years, up to $100,000, first 5 years, 0% interest, and below market rates for the last 5. Robert, if you can try the next. The first 2 programs discussed focused on EDA's direct assistance into the marketplace and the small business community. The next few projects, or programs rather, talk about our ability to leverage with our partners. Community development finance institutions are institutions that are federally. I'm hearing a ringing coming through. I don't know if that's okay. Sorry. That are federally regulated and approved to work in areas. They lend proceeds. They don't take deposits as banks do, but they typically will work with companies that are least likely or a little more challenged to obtain conventional debt from a traditional lending source or a traditional bank. As with any lending institution, the EDA included, when we take and give a loan to someone, we reserve a portion of funds to help offset potential losses that may occur in that situation, or if that situation develops. CDFIs have the same requirements. They need to reserve a certain number of assets to help cover any potential losses. When they do that, that limits their ability to put dollars out into the street. So what we're proposing to do is partner with New Jersey-based CDFIs to guarantee a loan loss reserve fund. So that'll free up their capital so they can put that money out into the street and service more people, more companies, I should say. There'll be some core criteria that that the CDFI will implement in regards to their loan programs that'll be associated with the COVID. Loans won't exceed $75,000. They'll have a maximum interest rate of 3.75%, and the terms won't be greater than 5 years. Their underwriting practices, they'll have that flexibility to be able to do that and create a loan pool of resources that folks will be able to access. Currently, that program is to be capitalized with $10 million of resources. Next slide, Ron. The Emergency Assistance Guarantee Program. I mentioned, that EDA has a long history of partnering with commercial lenders, and we're looking to continue that and leverage additional dollars. We do that through historically, we've done that through a couple different venues where we will either partner directly with financing or guarantee financing from that institution to a particular borrower. That guarantee generally takes a sue or equal share in the collateral if in the event that there's a default. This Emergency Assistance Guarantee Program will take a subordinate position to the bank, giving them an additional layer of comfort for them to offer assistance to companies. The guarantee will be capped at $100,000 or 50% of a loan. So a $200,000 or more loan could receive a $100,000 guarantee, whereas an $80,000 loan would have a $40,000 guarantee. Similar criteria in regards to the loan program, where we're targeting companies that have $5 million or less in revenue, certainly a commercial location in New Jersey, have been in existence for at least 1 year. One thing that I forgot to mention on the prior couple of programs, including this one, as I mentioned earlier, the EDA is a self-supported independent authority. Our independence enables us to charge fees that are associated with our programs. That's essentially what keeps the lights on for us. Thankfully, pays my salary. But for these COVID-related programs, there are no fees associated with the application and or closing costs. So essentially, this is a application fee guarantee, as well as the loan program itself are exempt from any fees that are happening. Next slide, Robert. The Entrepreneur Support Program, as part of the governor's economic development plan identified or released in October of 2018, focused a lot on the innovation economy and startup companies and entrepreneurs that are looking to develop the next biggest event, and ideally that can happen here in New Jersey. We've gotten had a lot of momentum over the past year and a half or almost 2 years or so since that initiative had taken off. But unfortunately, due to the volatility and uncertainty of the market, a lot of investors have kind of taken a step back and said, I don't know if I'm ready to do that just yet. In the spirit of not trying to maintain that momentum, the EDA is going to offer guarantees to these investors to help support to continue to help supporting these companies. Again, some basic criteria is that the company would be under $5 million in revenue and would employ less than 25 people, have their headquarters here, and at least 50% of their workforce located here in New Jersey. So again, a small program to kind of help keep that innovation economy moving forward. Next slide, Rob. Technical assistance, right? So the SBA programs that the Congresswoman had mentioned earlier and EDA programs for that matter are relatively complicated, right? There's no ifs, ands, or buts about it. When applying for government resources, although we're trying to streamline applications, trying to streamline the process, but we need to make sure that all of the I's are dotted and T's are crossed. The EDA is partnering with 4 institutions, and for some reason only 2 are showing up on my screen, but let me get the other 2. We're partnering with 4 institutions: the African American Chamber of Commerce, the New Jersey State Veterans Chamber of Commerce, Rising Tide Capital, and the statewide Hispanic Chamber, to help companies through the application processes through the SBA. So when folks need assistance and you contact one of those 4 organizations and you're trying to apply for SBA funding, those institutions can help assist you in partnership with the EDA. Next slide, Rob. Right, so our existing portfolio of clients, we've got 350 to almost 400 loans in our portfolio. It's a revolving loan program that we've had for 40 years or so. The governor has made the request for New Jersey-based institutions and institutions at large to be flexible in understanding the client's needs. As they've had to close their doors, they're unable to make payroll, they're unable to pay rent and related items. EDA wanted to certainly set an example and take the guidance of the governor and look at our existing portfolio. We're offering payment moratoriums for clients. We're extending maturity dates as needed. We're offering subordinations as folks may need to take on additional debt. And again, no fees are associated with that. I mean, certainly there's generally costs about modifying documents and taking things to make revisions or modifications to things. But again, those are free of any fees that are associated associated with any adjustments or modifications that are to our existing portfolio of clients. So that's I think that's my last slide in regards to full-on presentation. Quick summary of some of the programs that we had just discussed. And again, at the bottom of the screen, hopefully you all can see it better. I think it's just that my screen's not maximized, is the cv.business.nj.gov site, as well as the 1-800-Jersey 7 number. If you haven't had an opportunity to get onto that business portal, please do yourself a favor and take a look there. You'll find an amazing amount of information that I believe you'll find to be very helpful. I think that might wrap it up completely, Robert. Well, this walks you through I wasn't sure what all was sent. This walks through what the eligibility wizard looks like, as asking a couple of basic questions about the company, what your NAICS code might be, how many employees you may have, and will identify essentially what programs you'd be eligible, not just at the state level, but could be eligible for on the federal side as well. With that, Monty, Robert, I think I'm through with the PowerPoint in itself.
Okay, very good. That's a lot of information that you shared, Paul. Thank you so much. And
Sure.
For people to take advantage of those programs, they go to that CV website.
That's correct. Yeah, that's where the applications will be housed. Even our website, the njeda.com standard website, is I don't want to say transferring, but linking folks to that site so that everything sits in one location.
Okay, and I don't know if you mentioned this, but what's the turnaround time that people can expect to whether, first of all, hear whether they're approved, and secondly, when the money can get to them?
Yeah, that's a great question, Monty. So, as I mentioned, the grant program, we had 27,000 applicants over a 4 or 5 day period, released on Friday. By Friday evening, we had, I think, close to 16,000. The hope is, at least on that initial round of grant applications, to have folks some dollars beginning next week. Mm-hmm. The loan program rolls out Monday, not knowing what the demand is going to be. It'll likely to be somewhat comparable, but I would say within 2 to 3 weeks of the application, folks should have some dollars in hand.
Very good. Very good. That's it. You actually answered the questions during your presentation, and I appreciate your time coming on board here.
Of course.
And visiting with us all the way in Livingston, New Jersey.
Easy to do from my back porch.
I know. The commute must have been pretty long.
I'll tell you, saving some gas bills. But when the dust clears, yeah, certainly I'd be happy to come up and have a conversation with you folks to just talk about broader picture programs that are available, and anything that I can do to help you guys recover. I'm glad to do it.
Thank you, Paul, so much. I appreciate it.
Sure.
Okay. I'd like to thank Paul and all of our participants today, and hope that our viewers came away with answers to their questions. If you're not a member of one of our chambers, please consider joining. Membership fees allow us to put on events like this, and you get to meet some pretty cool people. Remember to stay safe, social distance, and God willing, this crisis will be over soon. I want everybody to have a happy Passover tonight and a happy Easter this coming weekend that are celebrating. So thank you for attending, and we hope to see everybody soon, and we could all network together in person. Be safe.
Yes, thank you, Monty. That was great. For those of you still on, thank you. There is a poll that I've launched. If any of you see that, if you could just answer that quickly, give us a little bit of a handle on who we have in the room. This was really, to me, very helpful to have. I hope that you all found it to be a good use of your time. We're glad to have you here. We will be doing more of this programming as time goes on. even after we get to be back in person, because we could see just how effective this means of communication can be. We will be posting this in replay. If you missed any of it, or if you think that anyone should know about this, please share it with them. And please be safe. Please follow the guidelines. If there is anything that we can do as a chamber, please reach out to us. If you haven't had the opportunity to join your local chamber, please do so. There are links on all of the websites to join. If you're already a member of one chamber, think about joining another. We can't continue to operate and bring this type of programming to you if we don't exist. So your support means everything to your local chambers of commerce. Thank you again. Stay safe until next time.